Pure Light here in Bend, Oregon. Thank you for being patient with me, just not as tech savvy as some people. So, we're going to jump right in. Today, we are talking about chronic ear infections, and I love this topic. In chiropractic school, I did my senior paper on chronic ear infections. So, we're going to get a little bit nitty gritty, nerdy, which I really love. And then we're also going to talk about a lot of different remedies, and I dove into blogs and podcasts, so spicing it up a little bit. So let's dive into some of the science. Now, the reason I love this topic so much is because there are so many families affected by ear infections. I think 90% of kiddos will experience one ear infection by age 5. And that's huge, right? Especially if you're a new parent or a parent that's never experienced it and there's a big fever and your kiddo's screaming out in pain. That's the last thing you want to see. I'm also very passionate because I was an ear infection kiddo as, even up until age 8. And then I've had 2 ear infections here in Bend, and it is literally the worst. So there's a lot that we can do, and I've learned a lot even beyond my research years. So let's talk about risk factors first. So, when I did my senior paper, it was a literature review, meaning I took studies from the years 2011 to 2016 and I broke it down for tubes, how effective they were. I broke it down for chiropractic adjustments, how effective, and any other treatments. And then I compiled all of that data into pretty much just a true review. And I'm someone who loves science. And so what that means is I really respect outcomes. Um, and I think that's what research should be, right? So, risk factors for chronic ear infections, especially, would be male over female, kiddos who are breastfed for shorter durations or formula fed. And people ask questions. Breast milk has a lot of antibodies. If babies are getting sick, your breast milk actually changes. And so, with that formula, there's not going to be those adaptations. So, I think of a lot of gut stuff for the breastfed versus formula fed. Under age 5, huge risk factor. Attending a busy daycare, repeated antibiotic therapy. We know that antibiotics wipe out all good and bad microbiome in the gut. And so this can create just a higher opportunity for infection. And then history of upper respiratory infections, you'll see those chronic ear infections show up. So signs, especially when your kiddo is young, if you're a first-time mama, teething and ear infections can look similar. And sometimes your babies aren't in a lot of pain. And so you may be like months later, and then you see something in their ears or some redness. If they're irritable, if there's difficulty with sleep, oftentimes fever will coincide with ear infections. Um, so let's talk a little bit about antibiotics. So it ear infections account for about 40% of antibiotics given. And that is a wild statistic because what we know about ear infections are about 80% are viral. So with an antibiotic, it's only effective against bacterial things. And so if you're going to give a kiddo an antibiotic for a virus, it will literally do nothing except wipe out your microbiome. And your microbiome is part of your immune system. So it actually compromises your immune system. So not helpful. I hope you tracked all of that. But essentially what's happening is they're giving out antibiotics left and right for kiddos when it might not be effective. So I also want to talk about Tylenol. I'm getting all of my controversial things out of the way first. So Tylenol is is given often to kiddos when they're in pain, and often given between 12 to 18 months. And what they're finding in studies right now is this can increase the likelihood of getting autism by 20 times, which is wild. But there's also an association when given Tylenol for increased asthma, eczema, ear infections. So When I think about this, the reason is Tylenol actually depletes your body's glutathione, and glutathione is the body's number one natural antibody, and they're primarily in sinuses and in the throat. So when you're taking Tylenol, it wipes out those natural antibodies. Your body will not be as well equipped to fight these things. That's why we see upper respiratory eczema. And common, sinus issues with Tylenol. So just a note, I know it's tough to see your kiddo in pain. I'm going to give you some other alternatives that you can at least try, right? My biggest thing here is not to shame you, but when I learned the glutathione thing, it absolutely blew my mind because, of course, I don't want to wipe out anything that my body is naturally making. So, with ear infections, even Western medicine agrees. The first 48 hours, watchful waiting is the best thing you can do. And the reason is because around 80% of the time, ear infections will resolve within 3 days on their own because it is viral. And that is super important to think about before you give antibiotics. Give it 2 to 3 days. Um, Now, if you're like, okay, my kiddo has had ear infection after ear infection after ear infection, I feel like 3 to 4 in the last couple of months, my doctor is thinking about tubes. This is the information for you. So, with my literature review, and I can totally send my paper to anyone. It actually got a really good grade. Not that that's what matters, but what they talked about, what I was really interested in, is tubes are tubes effective? And so, what they found is they made a placebo group and then they did tubes in another group. And they waited to see if there was any recurrent chronic ear infections. 40% of the placebo group did not have another episode, and only 35% of the surgical participants did not have another episode. So that is a 5% difference. And if I'm going to put my kid under anesthesia and have a big surgical, um, you know, event, I want to have some really good statistics. So it's great to know there's only about a 5% difference. So what they found in the research is tubes help with the short term, but there are no sustained benefit, and oftentimes, well, they always fall out, and sometimes they'd have to be put in again. And tubes can cause hearing loss, um, and just essentially scarring in the ear. I've seen a lot of kiddos with that. So recurrent recurrent ear infections, I don't want to minimize this because it can be scary and it can also affect speech and long-term hearing as well. So here are some things you can try first before you have to go the tube route. So number one, get adjusted. Ear, jaw, upper cervical, they're all very, very connected. And essentially, what happens if there is not proper communication or if there's interference up here, it can be very difficult to drain properly. I think it was last week we had 3 ear infection cases, which it's wild that I'm doing this today and not last week. Um, but yeah, getting up here, every single one of those kiddos had upper cervical that needed adjustments. Number two, get off any high mucus producing foods. So I think of dairy and sugar. If your kiddo is getting sick, they should absolutely not be eating either of those. Um, I even think about young kiddos, like avocado can be high histamine, meaning high inflammation in your body, or strawberries also ignite a histamine response. So look up some histamine foods and make sure you're avoiding those as well as dairy and sugar. Garlic mullein oil. I use this with my ear infections. You can do this a few times a day. What you'll do is you'll have your child lay on their side with their affected ear up and just drop the drops right into it and let it sit for about 15 minutes. If your kiddo's busy, they can be sitting up, but laying down. I know my mom used to, when I was young, not last year, she used to read to me while I would just like have the drops sitting in my ear. And if your kiddo is someone who gets sick often, be proactive. If they start getting a cold or a runny nose, just start the drops then. Another thing, here are some fun things that I learned in some of the latest blogs that I've personally never tried. Um, Onion earmuffs. So I'm gonna drop a little recipe for you guys to try. Essentially, you cut an onion in half. You're gonna bake it at like 350, and then you get to wear the little earmuffs, and it helps kill the infection. That one I've never tried. Red light therapy. I always recommend red light therapy. I have a loom box that I just got. I know there are a couple others, but you can always reach out. But a couple minutes in front of the red light can really, really help activate your immune system and decrease inflammation. Another big one to think about, especially with recurrent, is your kiddo a mouth breather? And this starts when they're a baby. If you've ever seen videos or photos and the baby just has their jaw open, you just want to close that. If your tongue is not resting on the roof of your mouth, your body is not engaging in its parasympathetic nervous system. So that would create more of a fight or flight, more where your body is not able to go into rest or healing mode. So adjustments also help. We want to think about unwinding tension. You could do some lymph massage, and you can also reach out to myofunctional therapy for kind of a longer term, um, kind of like longer term game plan for unwinding some of that cranial tension. Salt socks. These are another one that are new for me. So you can actually put in a white sock. I'll drop the recipe in here as well. We'll have a couple of different links that you can go back to. You're going to put coarse sea salt. You'll heat it up on the stove and then put it on your ear. This helps with pain. So if your kiddo is in a ton of pain, get a salt sock, and that will help extract fluid too. So if you think about fluid in the ear, salt sock is the direction you want to go. You can also get an otoscope at home on Amazon. I don't think they should be too much. And then it'll show you, like, here's what you're going to look for. So if you want to avoid going into a primary care provider, that would be a great one to add to your at home bag of remedies. I know we have a lot of mamas that are just absolutely incredible. And the amount of stuff and resources you have, like, definitely Autoscope important. My favorite, I'm going to link this. My favorite thing to send parents is just homeopathic remedies. So, this website that I'm going to drop, it kind of breaks down because there are quite a few different strains of ear infection. So, homeopathic is great for specific. And this will break down, here are the symptoms, here's what you're going to use, here's the dosage. It's one of my favorite go-to, and I love, love, love sending parents this because it just gives you an opportunity to try something at home. So that's Rachel Rich's homeopathy, I believe, is what it's called. So those are my go-to. I absolutely love talking about this. If you have questions about any of it, I know for me, when I got my ear infections, I got adjusted twice a day, cut out sugar, increased my vitamins, did the garlic mullein drops. And in about 2 days, I was back to normal. And I don't want to minimize how terrible it was because it wasn't fun. But it's good to go through these opportunities so that I can reach out and then, like, hey, I've been there. I can look into some stuff. And we're always here to help you. So if you have any questions, or if you wake up and your kiddo is just not feeling well, please text us and we would love to help empower you to walk through it. All right. I hope you all have an amazing day. Thanks for joining me.